project manager, who's just joining us, I think, for this session, and probably not the breakout groups, who's going to be talking about how do we frame homelessness. So I'm going to hand over to
Great,
Catherine.
thank you. Thanks for this opportunity to speak today and to join your session. I'm just going to share my screen so that you can see some slides. I want to make sure I've got the right version here. Hold on 1 second. Yes, right. Okay, can everyone see a red screen? I'm hoping for some nods, yeah? Great, fab. So as we go through, there are a couple of videos in here, and on one of them we've just checked the volume is a little bit quiet. So if you could turn the volume up on your own computer and listen hard when we get to the first video, that would be really helpful. So I think I've got about 20-25 minutes. And I'm going to talk about changing the way that we talk about homelessness, the way that we communicate about homelessness, to help us build public support and political commitment for change and the actions that we need to create change. And just as I was coming into this session, I had a quick chat with Kate, and she mentioned the importance of movement building here, and the idea of sort of joining forces with our communications and combining them, but also the idea of having a consistency of message, and framing really helps us with that, because it gives us big concepts that we can use, but those concepts can be applied creatively and naturally to the different types of communication that you're doing. So there's lots of flexibility. What I want to talk about today is not about a rigid set of rules, but actually some opportunities to give our communications more power and more resonance. So a really quick summary of what I'll go through. I'll run through our reframing homelessness research and what the research told us. I'll quickly recap on the shared sector understanding of homelessness, which I'm sure will be very familiar to you. I'll then show you some film and talk a little bit about what the UK public thinks about homelessness currently and the evidence we have for that. And then I'll quickly show you our most effective values and metaphors for reframing homelessness. Throughout, I'll show you some examples of how Crisis has been putting these frames into practice to bring them to life a bit. And then at the end, I've just popped in a slide with a few thoughts and reflections on framing housing-led, framing housing-first approach that I hope will be useful to you and that you might want to chew over in slower time. And then I'll show you a couple of additional resources on framing homelessness that are available to you if you want to dive in and learn more. This will be quite a pacey session, and if it whets your appetite, which I hope it does, there's a lot of free resources available on the Crisis website for you to dig into. So just before we dive into the research itself, I find it's helpful as we go through to hold some questions in our heads as we go through, questions that we ask ourselves, and to think about how the content we'll talk about today might affect your answers to these questions. So what's the one thing that you want people to know about homelessness? And I guess in this case, what's the one thing that you would want people to know about housing-led or housing-first approach? Do you feel that that message is being heard right now? Is your message getting through? And if not, some thinking about what might be getting in the way. And I think you've probably been doing some thinking earlier on in the session this afternoon about some of the challenges around communicating housing-led, housing-first approaches, some of the barriers that we might be facing in public attitudes. So just hold those questions in your mind as we go through. And then I'll give you some background on the research. So a couple of years ago, Crisis commissioned the Frameworks Institute to do a piece of research for us in 2 phases, looking at, in phase 1, looking to get a really good understanding of the current views around homelessness in the UK. Firstly, held by the homelessness sector, so through in-depth interviews with a number of organisations across the UK, the research developed a really good understanding of what we call the shared sector view of homelessness, and I'll run through that in a few minutes. And as part of that piece of work, the research looked closely at published materials coming from organisations in the sector and what messages were being included in those materials. So that could have been campaign materials, press releases, social media activity. And this first phase of the research also looked at media coverage. So across the broad landscape of media outlets in the UK, across broadcast, print, online, looked closely at how homelessness is being covered, what messages are included, what imagery is included, for example. And then fourthly, in this first phase, took a really deep look at public thinking through in-depth interviews and surveys and on-street interviews. And I'll show you some extracts of that work a little bit later on. And what the first report found, and you can read the whole report by accessing it from our website, it's called Finding a Better Frame. What that first report found is that if you look at the sector view of homelessness and you look at public thinking, there is a gap between those two things. And often if you look at sector materials, and in particular if you look at media coverage, you can see the gap being fueled, being widened by the messaging that's included there. So in the second phase of the research, we then turn to think, okay, is there a way that we can use framing to try and shift attitudes held by members of the public closer towards the sector view of homelessness and build commitment towards the action and change that the sector is seeking? And the good news is that the research recommends a small number of frames that we can use to do just that. Does anyone have any questions on that background before I go ahead? Okay. So I'll just recap really quickly because this will be familiar to you. The sector understanding of homelessness, and it's this story, this sector story, that our frames are designed to help us tell. So firstly, what is homelessness? A lack of affordable, safe, secure accommodation, the lack of a home. Homelessness can be hidden, like sofa surfing, or visible, like rough sleeping, be short or long term. And that there are some groups that are more at risk than others of becoming homeless. And when we look at public thinking in a few minutes, you'll see that there are some synergies in these groups, but there are also some groups that are completely missing from public thinking. And then secondly, on the sector story, what causes homelessness? We are talking about systems. Particularly, we are talking about poverty being one of the biggest drivers of homelessness, and then also other systems at play here. So unaffordable rent, lack of social housing, lack of adequate welfare support, violence and trauma, mental health, physical health issues, relationships breaking down. And when we think about the consequences of homelessness, it's not only consequences for the individual facing homelessness or the small group of people around them, but we're talking about wider negative consequences for society, for communities, for services, for the economy. And lastly, when turning to think about, is ending homelessness possible? Yes, it is. And that the systems that we have that are causing homelessness in our view can be redesigned. If we make the right policy choices, we can stop homelessness from happening. So this is the shared sector story that emerged from the first phase of our research. Okay, and now I'll move on to public thinking. So this, what you'll see in a minute, is a montage of film taken during our on-street interviews in the first phase of the research. After the film, I'll go on to summarise what's in here because it's quite rich. There's quite a lot going on. Here is where the sound is a little bit quiet. And I just need to move the film to the right place, if you just bear with me. This is part of a wider training video, which is available on the website. I'd really encourage you to have a look at it. Okay.
What comes to mind when you think of home?
Warmth.
Warm, cozy.
Warm and comfortable.
Nice warm surroundings and family.
With people that you care about.
Family.
A home is a happy family and a nice bond.
Family. Family. People more than a building or anything like that.
It's like the house I live in with my family.
You could live in any house,
Okay.
but your home is where your family are.
So what about the word homelessness? What does that make you think of?
Living on the street.
Living on the streets.
Sleeping on the street, could be living on the street.
People on the streets.
Be out in all weathers.
Cold.
Cold, freezing cold, dark nights.
Why does homelessness happen?
Drug addiction.
Addiction issues,
Drug and alcohol addiction.
psychological issues.
I'm sure a large percentage of the people who are homeless and on the streets have got mental health issues.
Mental health.
Mental health issues.
Could be broken homes.
It could be family issues.
Breakdown of family.
People whose marriages are broken up and have nowhere else to go.
Family might have kicked them out.
Kicked out of their homes.
Some people, it was due to their way of life.
They couldn't pay rent, they didn't know how to look after their money.
And also there's people that choose to live on the street as well.
Certainly some people, as far as homelessness, that is their choice.
People that are down on their luck.
Some have had absolutely, just a bad deal.
Circumstances that just life issues.
It's not their own fault. It's just society has changed so much. Jobs are hard to come by.
There's massive social issues that impact on people's lives.
The jobs aren't there, people get chucked out their house.
Suffering so much social abuses.
And end up in a downward spiral.
You become disenchanted with society.
It's a kind of ever decreasing circle.
Who's responsible for homelessness happening?
Obviously, the government, probably a government responsibility.
The government has to take some form of responsibility on how things are done.
Government had to pay attention to it a little bit more.
10% of the population own 90% of the wealth.
And so it's just frustrating how people can claim that, there's no money for these things when there is so much money.
They take chances away from people and of course to make it sound good as they're doing it.
The people can't work and they're denigrated for not working because there is no work.
So what do you think should be done to address homelessness?
More money into mental health facilities.
Good addiction support for people who fall by the wayside.
I guess more money put into social state, into hostels and things.
I think it will always happen, regardless.
I suppose it's all kind of chicken and egg things.
You will always find it. You will always see it. People will always run into difficulties and problems.
Some of the kind of people you see around here are actually tragically almost beyond help.
Welcome back. Okay, so there's a lot in there. You can see some frowning faces. So I will just recap very quickly on some of the really deeply held ideas about homelessness, and we call those ideas in framing shortcuts because they're very deeply held notions that enable people to shortcut to answers to questions really quite quickly. So first of all, you'll have seen the idea that homelessness happens because individuals make bad choices in their lives, and those choices are often linked in people's ideas towards drug and alcohol use, addiction. It may be to do with poor management of money. It may be to do with poor management of their relationships breaking down, or it may even be a lifestyle choice. So we have this really individualistic idea of why homelessness happens and who is to blame: the individual facing homelessness. When we ask people about those affected by homelessness, they are really clearly thinking about rough sleeping. And the core group that are affected by homelessness in people's minds are middle-aged men who are rough sleeping, young people who've run away from home, or women who are fleeing abuse. And these three groups that are very strongly in people's minds when they're picturing homelessness. And if we ask people, you'll have seen, if you ask people about solutions, we get pretty much complete silence. And when people can draw on ideas, solutions, it's really about emergency responses like drug and alcohol services or hostel provision. And when we delve a bit further into people's views on those services, we find that there's this quite strong idea that services are already there. It's either that people just don't know enough about them, or that people are actively choosing not to engage with them. And when we ask people about who's responsible for addressing homelessness, there's a strong idea, but quite a vague idea about government responsibility. But then when you delve into that, there's a high level of negativity and skepticism about whether that's effective. There's a sense that the government is either failing to do something about homelessness or is actively choosing not to engage. And therefore, it's just how things are. And then lastly, you'll have seen some discussion in the film about the economy and about jobs. And there's a sense that the economy is something that we can't control. We're all at the mercy of the economy. So if it changes, then we might too be pushed into homelessness. So you can see that when we add all of this together, it brings us some quite difficult communications challenges. And summarising them, it's this: there's a narrow definition of homelessness, a narrow definition towards rough sleeping, towards the small number of people that are effective, and therefore the types of solutions are also narrow. The logical solutions are also narrow. You'd have seen a lot of individualism here, so a lot of blaming individuals, which really leaves systems right in the background of people's thinking. And prevention solutions are really missing, particularly the idea that there could be upstream solutions that could help. And also you've seen that nobody on that film mentioned housing at all. So that concept is really missing from people's thinking. So when you add all that together, you get a sense of fatalism and a sense that there is no efficacy. There's not much that we can do about this. It will always happen. You will always see it. So we can turn to framing to help us with this. So framing is using evidence to guide the language and image choices that we make when we're telling stories, when we're communicating about homelessness. Framing evidence can help us look at what to emphasize. It can help us think about how to explain things, to help us build understanding, build empathy, build emotional connection. And really importantly, it can help us think through what to leave unsaid, what to avoid activating through our communications in order to help people think differently, feel differently, act differently. And we can frame with values. So we can frame with commonly held, really deeply understood ideas about what's important in life, what's right and what's wrong. We can frame with values really effectively, and I'll show you the most effective values framing homelessness in a second. And we can also frame using metaphors, using strong mental images to help people understand complex ideas. So I won't dwell on this too long because I'm just conscious of time, but I wanted to show you how we arrived at our values frames. And this is the same method used to arrive at our metaphor frames, which I'll show you later. But it's basically taking groups of the public, members of the public, splitting them into groups and showing them different messages framed in different ways. And then asking those groups to answer a series of questions about homelessness with lots of different possible responses. And when we compare groups, looking at groups that saw a message about homelessness framed with compassion versus equality of opportunity versus interdependence in society versus the idea of home as a moral human right, those groups that had seen a message framed with interdependence in society or framed with moral human rights, when they answered our questions, their responses were significantly closer to the sector view of homelessness. So we can be confident that using these frames gives us potential, gives us power to shift public thinking towards the sector understanding. And here, I just want to show you a couple of very basic articulations of these values frames, and I'll read them quickly. So moral human rights. In our society, we believe in treating everybody with dignity and humanity and upholding everyone's basic human rights. All of us as human beings have a moral right to decent housing, yet right now many people in our country are homeless. Treating all people with dignity and humanity means making sure everyone can afford a safe and stable home. And then interdependence. So interdependence. In our society, what affects one of us affects us. When some people are struggling, it hurts everyone. But right now, many people in our country are homeless, and this affects us all. Making sure everybody has safe and stable housing benefits us all by creating a stronger society. So you can see these two frames are working hard for us in twos. The first way is that they are positioning homelessness in wider concepts of humanity and society. So dislodging the idea that homelessness only affects a small group of people and a small group of other different people. And then also both of these frames are bringing in the solution. So bringing in long-term, affordable, safe and stable housing into the message. So I'm really conscious of time, so I'm just going to skip on a few slides, and you can obviously look at these in your own time. These are some examples of crisis work using these frames, but I just want to make sure that I leave enough time to show you framing with metaphors, and also to show you a slide on some thoughts on framing housing-led, housing-first messaging. But this is an important point about framing statistics. So framing gives us a real opportunity with using stats and using numbers. If we frame a statistic with a value, it helps us to show people why that number is important. And if we also look at this example, this is also using an image. So it's using the image of a classroom to show this included the on average 9 children would now be in poverty. So it brings up a mental image and helps people to understand what you're talking about using images that are available to them already. And that links into the idea of framing with metaphors. So we can use metaphors, we can use really strong mental images to help explain complex concepts. And when we're talking about framing homelessness, it really helps us to explain why homelessness happens. And in our original research, we tested several different metaphors to help us do that. And the most effective metaphor for framing why homelessness happens is this. So the idea of constant pressure. So constant pressure, poverty puts constant pressure on people. If the pressure builds up, people can be pushed into homelessness. This pressure comes from high housing costs, low wages, and inadequate government support, which can build up to a breaking point. A sudden increase in pressure from a life event like losing a job, a relationship breakdown, or a health crisis can quickly become unbearable and force people into homelessness. So you've got this idea of the external forces that are bearing down on people in their lives. And you've got this idea of systems like how high housing costs, low wages, pushing people into homelessness. So it's dislodging the idea that it's someone's fault. It's dislodging the idea that it's all about their own decisions. It brings in external forces. And I've got some examples of using this in practice. And again, I'll trot over these for now, and you can look at them later if you wish. And then I just want to show this quick film, which brings together the framing that we've been talking about so far in one place. So see if you can spot the frames as we go through. And then I'll just show you some thoughts on framing housing-led, housing-first approaches.
To the young man struggling with his mental health. To the little boy whose mum had to leave before it was too late. The construction worker who was made redundant. to the teenager leaving care without anyone to fall back on. The family, under the constant pressure of rising rents, to those criminalised simply for having nowhere to go, and to the 170,000 families and individuals who are homeless in 21st century Britain. We owe you dignity, respect, and a safe place to call home. By giving people the right support when they need it, and taking actions to prevent homelessness in the first instance, we know that a world without homelessness is possible. Our society is stronger when everyone has a place within it. Be the generation that ends homelessness.
So I hope you spotted some of the frames in there, but I'll just quickly run through it. So you saw a wider experience of homelessness there. You saw children, you saw groups of ethnic minority groups. You also saw systems causes. So you saw people leaving care. You saw redundancy. You saw the Vagrancy Act. You saw the use of the constant pressure metaphor with the idea of rising rents. You saw moral human rights being used to frame statistics, and also system solutions, and really pushing the idea that ending homelessness is possible through permanent housing. And lastly, interdependence values at the end, collective action, bringing people together into the generation to end homelessness. So lots going on, but I hope that was helpful as a demonstration. And then lastly, in just a minute or so, I've put on a slide here some thoughts about framing housing-led, housing-first approaches. And I think to start with, I'll just draw out some points here. I think that moral human rights framing has real potential here. So the idea of treating people with dignity and humanity means making sure they have a safe and stable home as an overarching idea, helps to dislodge the idea that some people are deserving of support and some aren't, by placing it in this idea of treating everyone like a human being. So the first line here, housing first treats people like human beings, giving people a home without conditions and the intensive support they need to recover and thrive in society for as long as they need it. So really positioning those using the service as human beings, and also the ability to thrive for themselves, but also thrive in society. So trying to widen it out. And then beneath that, the idea that systems and services that ask people to jump through extra hoops before they can access stable housing to end their homelessness are simply inhumane. So drawing back to this idea of treating people like human beings. And to the right here, I wondered whether we could think about using the constant pressure metaphor to bring in the idea of the role and impact of those support services. So providing the right support with drug and alcohol dependency and with mental health issues could be the key to releasing the pressures that have forced someone into homelessness. And then beneath that, bringing in this wider idea that actually we all need help and support in our lives, especially in difficult times, and we all depend on public services in different ways throughout our lives. So dislodging this idea that this approach is providing sort of special services. And then towards the left-hand side here at the bottom, just wanted to bring in the idea of prioritizing and designing services, and this idea that we can design them to include and meet the needs of everyone. So the idea that we should prioritize services that are designed to include and meet the needs of everyone, helping us all to contribute in the best way that we can. And lastly, at the bottom, there's just this really fundamental idea that a stable home is the foundation that everyone needs in their lives. Everyone needs to thrive. So positioning the stable home part as something that everyone needs, not just those who are using these services. I hope that's been thought-provoking. You may not agree with these ideas, but I think there's real potential, particularly in the values frames, to build support and also to try and tackle some of those messaging challenges that you might be thinking about and facing. And then I just want to show you really quickly, we've got lots of resources on our website around framing homelessness. We've got a very short version of the research, training videos and a toolkit. So please do go and have a look at those if you're interested in putting these ideas into practice. And that's it from me. Sorry, I've gone over time.
Catherine, don't worry at all about going over time. That was fascinating and really thought-provoking, and I'm really sorry that I'm going to have to leave you all in a moment because I would be fascinated to listen to the discussion that we're going to have in the breakout groups. Do you want to stop sharing your screen, and then perhaps Paula can explain what happens next and also the timings?
Yeah, okay. So I've put you all into 2 breakout rooms, and when I do press go, you'll automatically go off into them. I think you've got to about 3:30 for the discussions. Catherine has shared the questions on the chat. I'll go through those again for you in a moment. I'll give you a 5-minute warning, which you will all get, and then I'll press the button for you all to come back in. But you come back in one room at a time, and it does take a few seconds, so don't panic if you all of a sudden nothing's going on, because it does take a little while sometimes. Just Catherine, go through the, so I need to scroll back up. So the 3 questions we want to do discuss within the breakouts was, from what you've heard, what opportunities do you think there might be for a housing-led system in Housing First in Norfolk? What might be the barriers be, and who would you need to be involved? So if I press go, Catherine, you're leading breakout room 1, and Lisa, you're facilitating room 2. Katie's taking your notes, and Anita is kindly taking notes in breakout room 1. Is that okay? Yep. See you later.
Bye, everybody. Have a good session. This is where we see the system's gone wrong and some people have been left.
No, Katie and they've just not moved over yet.
Gail is waiting with anticipation.
It's a bit, is she frozen?
Nope, just gone.
They're gone. Yeah, it does take about a good 30 seconds for everyone to move through.
Yeah. Okay, I'm sorry I have to leave. I've now got to get my skates on.
Yeah, no, you.
But I think that's really good. I thought both presentations were really good. That last one from Catherine was truly fascinating.
Mm.
And I think that's a comms session all in itself for all of us in housing, is how we communicate. I just wonder whether we ought to be organising a Homes for Kathy session, really focusing on comms, rather than just having the housing practitioners.
Yeah, rather than the Housing First, I wonder if Catherine or Kate would come and do that session, because actually we did a bit about changing the rhetoric, didn't we, with Martin? But actually this is really hands-on stuff.
Yeah, this was more useful, actually.
Yeah, way more useful, because it's so practical, but also there's loads of stuff that we can all go and nick, so we don't have to keep reinventing the wheel, Michael.
Yeah.
Especially when you want a really good, strong message and somebody else has done it, and you can just.
So. Yeah, absolutely. But I think it was also, recognizing how you get through to the public and how you package the message differently.
Yeah, exactly.
Okay, I will love you and leave you. I'll see you next week. Have a good weekend, and I will be off. I've got 53 minutes to get to Norwich.
Okay.
It's like there's been a massive queue for coffee, isn't it, at a conference hall?
I think everyone's back actually. I've just resumed the recording as well if you want to do the feedback session now. Thank you.
Yeah. Should we start? So group one, I'm just going to give a couple of notes from that and then hand on to group two just to ask for, you know, 1 or 2 reflections. We'll get the typed up notes. And as I said to group one, just circulate those amongst you just to make sure we've not missed anything. I think we had a bit of a problem with sound going in and out for poor Anita. She was trying to take notes. So that's always a challenge, isn't it? So in terms of opportunities, we said quite a few things, but really we said the opportunity is the events that have happened, and awful as the pandemic has been and continues to be, we have to seize the opportunities of the everybody in, and the kind of public narrative around homelessness at the moment, that we can do it, custodians, as people working now in these roles of responsibility, that actually the question should be, why can, you know, how can we afford not to do this and not to get it right? In terms of barriers, I said I would be the controversial one. That we think there's a real need to act as a county, and that sometimes within each of the sectors represented here, there can be barriers between the organisations. That's before you get on to, and I'll say that happens for housing associations. You know, this is not lobbing rocks at any other sector. We're very good at, you know, don't look at my homework. And we assume that happens in other sectors. We think that sometimes the approach to, for example, we have no common housing register across Norfolk. If we can't move to that position, surely we at least need to move to the position where the housing-led system we're talking about is genuinely partnership based, is genuinely that actually you could be in Yarmouth one day but you really need to be in King's Lynn or whatever, that people actually do move around, and that's kind of okay. We did have quite a few more points. I think that was probably our busiest point, what the potential pitfalls are. And we very firmly said quickly the strategic housing partnership need to be on side. We hope the right people are on that, and that the right agencies are represented. We said a load of other things, but I think the point we wanted to share was really we need to bring our communications teams with us, because if we're going to make this change, we need to get the narrative right, so we have the support of the woman on the Norwich omnibus, the, you know, Joe and Joanna Public, to really understand what it is we're doing, and hopefully to feel really proud that they live in a county that's prepared to do this and work together. Because I think, you know, I came to Norfolk 2 years ago, and I think it's a really proud place, rightly, and this should be something else that people, you know, individuals, the business community, the huge philanthropists and landowners and moneyed individuals should come together on and feel really genuinely proud of. So we think a common narrative that our comms teams really get and kind of relentlessly get out there is important. And that was for group one. Group two, Lisa, did you want to
I didn't take
on
actually
that,
any notes. I did a lot of waffle, and there's really a lot of talking, but no notes.
I'm sure Katie will be fine.
Do you mind, Katie? Sorry to put you on the spot there.
Lisa.
You're welcome. I'm sure you'll get your own back another time.
Yes, I'm sure I will. So yeah, we started talking about opportunities, but very quickly fell into a lot of barriers that we could think of that were similar to what you had. We had a good discussion around, Lisa had mentioned somebody who'd been offered social housing on top whilst they're currently sleeping in their car, and then Kate fed back about kind of not to try is not to fail. So that whole kind of mindset around, you know, it might be that they're worrying about what might come if they do try, and that kind of thing. So that's about having the right support there and the opportunity to have the right support there. We talked about needing the flexibility for commissioning, because Lisa talked about not having high numbers perhaps of drug and alcohol cases, so no one's going to want to commission a service perhaps in North Norfolk and come over that far, but Norwich faces a very different kind of demographic there. talked about barriers for the constant need to apply for grant funding, and not MHCLG not thinking about it strategically and just constantly saying you've got to apply for this pot of money or that pot of money, and how that makes it difficult. But then Kate did say something that came out of the Oxford study was that they are already putting a lot of money into this anyway, and it's actually just about spending it right some of the time, and money that's not going anywhere and spending it right.
We said some of the other barriers could have been the allocation schemes for each local
Yeah.
authority, that they could potentially be reviewed maybe and
Yeah,
re-looked
so-
at, especially for like your choice, choice-based letting schemes as well, and what barriers are there preventing people from accessing the housing waiting list and being in areas where they wish to live as well.
Yeah, so yeah, I know if most areas within Norfolk have just looked at their housing strategies, and we were involved in quite a lot of them. But yeah, looking at those again and look at breaking register barriers, and finding landlords that are willing to take things forward and trust a housing first model, and that's not just social landlords but private landlords too, and trying to sell that almost to your team or I think somebody said about kind of people not wanting them believing in the housing first model but not wanting them in their community, and that kind of thing is difficult. Lack of housing obviously was one of the barriers. There's not enough, and then the people that we felt we needed there were health, particularly mental health and support for drug and alcohol services, wraparound support, social services, Norfolk and Waveney CLG, probation, and then we talked about philanthropists and socially minded business owners, etc.
Fantastic, Katie. Did we miss anything, Group 2?
What we'll say is circulate those notes. We'll circulate the slides, and also make sure people have access to the recording of this. So if if there's people who did want to share it with Kate, is that okay given the Oxfordshire stuff you shared, if it's within the organisation?
Yeah, that's fine. I think it's high level and broad enough that it's not letting any cats out of the bag, but yeah.
I did wonder whether it's worthwhile, and maybe this could go, I don't know if anybody has on the strategic board, whether they consider looking at the Oxfordshire model or maybe doing something very similar and having something coming into us and looking at how we work as Norfolk and do a similar type of study.
So Michael is on the Strategic Housing Partnership. And then certainly, I think Joe from Flagship is on it. So,
Yeah, I'm going to be the health representative for the start and just see how it goes, depending on my capacity. But yes, I'm happy to take those things and have that discussions, in that forum, definitely.
The Oxfordshire work will publish within the next few weeks. And so once it's kind of fully published, obviously it'll be accessible on our website, etc. But we'd be really happy to come and talk more fully about the findings and the whole process there. That
sounds great. Yeah, because the comparisons with Norfolk as a county and Oxfordshire seem very similar in some ways.
That was my thinking. I was thinking it was good because we've got the cities, we've got the rurals, and I think it'd be good to do a comparison and maybe even consider a feasibility study within Norfolk as a whole as something to move forward with.
Yeah. How much do you think each area needs its own feasibility study, Kate? And how much could we, nick what they've done in Oxfordshire? I mean, learn from good practice.
Yeah, I think it's all relative, really. It depends how significant your change needs to be. I don't know, it's a difficult one. I guess it depends how far you need to move the thinking. So if there's a lot of convincing to be done, then you might want evidence locally. However, the point of a lot of these studies is to say, learn those lessons and apply. So if there's enough similarity, what we don't need to do is a feasibility study in every single area to say that housing-led's a good idea, because really that exists.
I think the evidence is there.
You might need to do a little bit of modelling locally to say, right, if we were to apply those principles, what's the time frame? Who are the key stakeholders locally?
Mm-hmm.
Were there any other thoughts, Kate, you had from things that have said, or is there anyone? And then I'll see if anyone has any closing questions. Anything else you wanted to say based on what we've just come up with?
I don't think so, really. I think that all feels fairly familiar in some ways, in that you're grappling with barriers and issues that other areas are also grappling with. However, I think there are real opportunities. In a way, you know, I agree, Catherine, COVID is a real opportunity. In one fell swoop, what happened with COVID is that we took away the argument of that it's not possible to bring people inside.
Mm-hmm.
You know, this idea through Housing First they have a lot, which is this, you know, significant amount of people that just really don't want to come in. That's not true. And what we've tried to unpick whilst COVID's been going on during the Oxfordshire study is that it gave us an opportunity to really access this group of people. So one of the big pieces of work I've done as part of the study is work to look at a strengths-based need assessment for all those people that came in, because about 50% of the people that came through emergency provision in Oxfordshire during Everyone In were sort of unknown. Which I think A, took them by surprise, and B, meant we didn't really understand what those journeys had been. And so that is a big piece of data that will kind of come through in the study. So understanding what the kind of challenges and who would be included. We've got a clearer picture of that now than we've ever had. So I guess it's, you know, the timing of now to look at how you then change responses is really key. I think the other thing that's been noticeable is that it's not just housing and homelessness people on this call, and that's really, really encouraging. It's good that there's already a recognition, and it sounds like through this strategic group that's been set up that there is there's somewhere for these recommendations to go, isn't there? And there's an active group that could take some of them on and really look at them. So nothing else from me. I think you've all heard enough of my dulcet tones. I'll shut up.
Are there any questions anyone wants to finish with? You can just you know, wave if you want. No, it's 3:45 on a Friday, and that's absolutely fine. Can I just finish? Sorry, Michael's not here to close the meeting. I know he did want to be, but can I just finish then by thanking Catherine and thanking Kate and thanking all of you for coming along. I think that's been brilliant. You know, every time I hear you talk, Kate, I learn a load of new stuff. So thank you so much. And please pass our thanks on to Catherine, who was, you know, we talked really positively about her session. I thought that was really helpful. So I don't know if you can clap, but thank you.
You're very welcome. As I said in our breakout group, there's a lot of that framing resource on our website. So if people are particularly interested in that, please do let us know, or contact me or Catherine. Happy for my details to be shared. As Catherine knows, I can talk about this for a long, long time. So if anybody is interested in anything in particular, feel free. And like I said, I'll make sure that the Oxford study is shared via this group when it's published. But yeah, feel free to keep in touch and keep talking. It'd be great.
That's brilliant. Thanks very much. Thanks all.
Thanks
you were a bit early.
Thank you all. Cheers.
Thank you very much indeed.
Thanks everyone. Thank you.
Bye.